My slides are visible or not? I'm not getting any answer.
No, no sound, no slides, ma'am.
Mm. Now the slides are visible.
No, ma'am.
No, ma'am, no.
Now,
Yes, yes, yes. Now we can see.
okay. So let's start now. We have studied about the role of microbiota in the immunity, or how our body is protected from different infections through the help of this microbiota. So we already read about the, if the gut is in homeostatic condition and if we are facing some gut dysbiosis. So in today's lecture we will discuss this point, the last topic of this second module, that is dysbiosis, causes, effect and disease implication. Causes, effect and disease implication we will study. So before that we have to just look at this picture, because this compiles the both condition or the factor responsible for the dysbiosis. So because ultimately we have to study the dysbiosis, causes, effect and what are the disease implications. So before that we should have an insights about the factor for the dysbiosis. Dysbiosis means what? There is an imbalance in the microbiota. Somehow there are so many factors which will lead to the imbalance in the normal gut microbiome composition, and the normal microorganism composition will be decreased. And there are so many different levels of dysbiosis. Dysbiosis level 1, 2 and 3. So it depends on the severity, or it depends on the composition of the microorganism. If only a little bit of microorganisms are diminished, then it is type 1. If moderate damage is there in the gut microbiome, it is level 2. And if 90% of the microorganism are lost, your gut microbiota is lost, then you are suffering from the dysbiosis level 3. So it has so many things. The factors responsible for the dysbiosis: antibiotic treatment. If you are on a drug since so long, then you may have a impaired gut microbiota. The normal microorganism will be replaced by some pathogens. And also the second one is diet. What kind of diet you are taking, whether it is healthy or a fat filled diet. Now physical damage to the mucosa. So there may be some physical injury. If you are having any kind of injury, any physical injury, that will also lead to the rupture or leaky gut, because anything can damage this epithelial layer. Any physical injury can damage this. So whenever it will be leaky, all the inflammatory molecule will be directly bathed into your bloodstream. So this will increase the chances of your infection, and this may cause the gut dysbiosis. So gut dysbiosis in short is the reduced commensal microbiota overgrowth of pathogens. Simply it is what? The reduction in the population of the good bacteria and increase in the population of the bad bacteria. Bad bacteria are also known as pathogen. Pathogens are what? Disease causing microorganism. So gut microbiosis, gut dysbiosis refers to the reduction in the common cells or the mutualistic microorganism who are offering us so many important role. They are using our metabolic machinery, they are using our digestive system, they are protecting us from different diseases, they are boosting our immunity. But if it is somehow imbalanced, then the overall growth of the microorganism will take place. But which type of microorganism? It will be a pathogen, it will be a disease causing one. So this diagram shows that whenever there is a gut dysbiosis, so your all the inflammatory molecule like this one will be directly bathed into your bloodstream, and this will lead to inflammatory responses. So we have already studied that this Salmonella, Klebsiella, all are pathogens. Salmonella typhi causes the typhoid fever, Klebsiella pneumonia that causes pneumonia and different respiratory diseases. So both this pathogen will do what? They will not allow the short chain fatty acid production, that is the butyrate. And if butyrate is not produced, then PPAR will not be activated, it will be inhibited. So if it will be inhibited, then it will increase the synthesis of nitric oxide synthase, and this will inhibit the beta oxidation in the mitochondria, and there will be anaerobic glycolysis. So oxygen will be present in the cell, and oxygen will do what? High oxygen will kill the good bacteria, and it will promote the growth of the facultative anaerobe. Facultative anaerobes were what? They were the villain, they were the pathogen. This cycle I am talking about, this one. So ultimately we have to prefer this one, gut homeostatic condition, because if gut homeostatic condition is not there, then there will be a very homeostatic condition, there will be no infection in our body. If the good amount of bacteria will increased, then a bad amount of bacteria will be automatically decreased. So this was all about the gut homeostatic condition and the gut dysbiosis condition. Now we have to actually focus on the what are the conditions in which dysbiosis occur, what are the effects of dysbiosis. If it occurs, then what are the consequences? So we are all aware of the fact that the global incidence of numerous immune mediated, metabolic, neurodegenerative and psychiatric diseases is steadily increasing. So you can see here, there are so many diseases, immune mediated diseases, metabolic, neurodegenerative and psychiatric diseases, because we know that our gut microbiome also protects us from so many mental diseases, so many mental disorders. So you can see all these incidents are increasing day by day, and the reason is obvious. What is the reason? So many of these disease, including COVID-19 infections, are associated with alteration in gut microbiota composition and function. This is very important. So I have already mentioned one point in my previous classes, that your gut, if your gut is healthy, then you will be overall healthy, no disease may occur. This is the reason, because your gut is controlling your immune system, your gut is controlling your mental thing, mental control, mental health and coordination, all those things will be controlled by the gut microbiota. So if gut microbiota is imbalanced, that is the dysbiosis. So it may lead to different immune mediated disease, it may lead to metabolic neurodegenerative diseases and psychiatric diseases. So the major factor which will be influenced if our dysbiosis will occur is that we may have so many different kind of diseases, not only just physical disease or the physical body will be influenced. No, our mind, our mental health will also be equally influenced by different factors. So you can see the most typical features of dysbiosis are a decrease in the diversity of the microbiota, a loss of beneficial microbiota, or an overgrowth of harmful microbiota. It means if dysbiosis is occurring, dysbiosis, then it will lead to what? Microorganism reduction, beneficial microorganism reduction. Good bacteria will be decreased, and the other condition will be microorganism will be increased, but the harmful one, the bad bacteria will be increased. So dysbiosis is a condition in which the bacteria which increased is the disease causing one, pathogen will be increased. So you have to take care of your overall gut microbiome composition. So this is the characteristic feature of a dysbiosis or a impaired gut microbiome or impaired gut microbiota system. What is the condition? There will be increase in the microorganism, but what type of microorganism? The pathogenic one. It will increase the pathogenic microorganism. So that, because we already know the term gut microbiota includes what? All the microorganisms residing in our gut, not only the bacteria but also the fungi, protists, archaea and viruses that lives in the gastrointestinal tract. So if the composition is A, B, C, D in different proportion, but if it is somehow altered like A, B, B, C, C, D, D, E, F, G, then its normal composition is altered, then this condition is known as dysbiosis. So you can see dysbiosis cause, effect and disease implication in terms of different kind of diseases. Dysbiosis can be caused by host specific factors such as genetic background, health status, infection or inflammation and lifestyle habits, or more importantly environmental factors such as diet, xenobiotics and hygiene. So you all know about the factor which is responsible for dysbiosis. So dysbiosis can be due to host specific factor. It means our own bodily factors like genetic background. If our genes are impaired congenitally, if our genes are not healthy, if our genes are inherited from a diseased mother or a diseased father, then there will be chances that our own gene will be impaired by birth. So this is the genetic factor, genetic background. Now, apart from the genetic background, there may be some adaptive factors. In adaptive factors, there are so many. Like if you are facing any kind of infection or inflammation, and adaptive factors are all about the our own lifestyle habits. Lifestyle habits, and in lifestyle habits, it may have the diet thing, whether we are doing exercise or not, whether we are having a very active lifestyle or a sedentary lifestyle, and whether we are on a medication or not, any kind of drugs, xenobiotics, drugs, food additives. In food microbiology, I have also taught the ill effects of different food preservatives, because nowadays there are so many food whose shelf life is more than 1 year, more than 2 years. So how it is maintained? This is maintained just because of the addition of different chemical preservatives. So always try to choose some food item in which they don't have any chemical preservatives, because this will ultimately influence your overall gut microbiome composition. So nowadays people are aware and they are choosing products which are free from chemical preservatives, because all the chemical preservatives are very harsh to our normal body, because it will deteriorate your overall health of the gut epithelial. And if gut epithelial layer is destroyed, the microorganism residing there will also be get disturbed. And if they are disturbed, how they will be able to perform their normal metabolic machinery? And if they will not do their normal metabolic machinery, then no such metabolites will be produced. And if there is no such metabolites, if metabolite is not there, we will have an impaired overall metabolic machinery. Impaired metabolic machinery means we will have so many infections, we will have so many inflammation in our body and different kind of diseases. So overall, this is a very important slide in which you can see dysbiosis is due to the host specific factor. It means our own bodily factor, and in our own bodily factor we may have some genetic factors, like we have inherited a impaired gene from our parents, so we will have an alteration in our normal gut microbiome. Now health status also, if we are facing any kind of infection and inflammation, then also this is a very bad thing, that our gut microbiome composition will be altered. And the most important one nowadays is lifestyle. This is the topmost or the most crucial factor influencing nowadays, mainly for the youngsters, because they are consuming only junk and fat related food. So in our lifestyle we have to just have a good proportion of healthy food, and we can have the junk also, but if we are taking it for 6 days out of 7 only junk, then we are destroying our gut microbiome. But if we are taking only one day or twice a month, then we will have a good microbiome composition. Nowadays there are so many studies going on related to what we are consuming as a snacks. The snacks item are very much incorporated with different kind of food preservative, food colors, flavors, and chemical additive. There are so many things. So what are the health complications out of it? If we are consuming on a daily basis a normal chips packet, so a normal chips packet may have different preservative, and nowadays there are so many flavors of chips. So flavoring agents are there, and also coloring agents are there. So what are the different disease implications out of that? So people are doing a lot of study on different snacks item, because we are living in a country, we are having a good amount of youngsters in our country. So they are readily consuming snacks each and every time, not only just as a snack, but they are consuming it as a food, normal meal, lunch, dinner, and breakfast. So what are the different health complications out of that? So people are doing that kind of study on a larger scale to make an conclusion out of it. So what are the different, they want to know that what are the exact specific molecules which are very harmful for our body. So there are a lot of things. Now, changes in the gut bacterial and fungal microbiota can be rapidly achieved by changes in macronutrients. This is an important point. This is, if we talk about biochemical changes, so we know that our major portion of food is carbohydrate. We consume carbohydrate in our every meal. Like if you talk about the lunch, we have a good amount of rice. Rice is a staple food. Obviously we will have a rice in our lunch also, in our dinner also. So we are having a good amount of carb in our every meal. So this is a macronutrient. Carbohydrate is a macronutrient. So what are the effects of having a macronutrient in each and every meal on the gut microbiota? So carbohydrate will do what to your gut microbiota is also a point. Now people are studying onto the effects of carbohydrate, because in an Indian diet the major portion is carbs, and after that protein, fats, and likewise. So is there any changes in the gut bacterial and fungal microbiota if we are consuming carbohydrate in a larger amount? So they may have some significant physiological consequences. As we can take an example, that if you are taking a diet which is rich in simple sugars, which will ultimately disrupt or impair your intestinal barrier. Your intestinal epithelial will be impaired if you are taking a sugar rich food, sugary food if you are consuming. Then it will also trigger, if our intestines disrupt. Now the leaky gut concept, this is somehow altered, this is impaired or disrupted. So disruption will do what? The release of inflammatory mediators in the bloodstream. So it will trigger the intestinal inflammation. And if intestinal inflammation will occur, it will negatively affect the host metabolism. Obviously, because all the inflammatory mediators are now bathed into its directly into its bloodstream, and if our blood is having so many inflammatory molecules, then our own molecule will be treated as a foreign molecule, and our immunity will react accordingly. So this will have a negative effect on the host metabolic machinery. So in most cases, interaction between diet and microbiota are necessary for the deleterious effect, as they do not occur in the absence of gut microbiota. Because if we talk about the comparison between a germ-free state, it means a sterile state, a mice who do not have any kind of gut microbiota, so they are showing that there is an absence of any kind of infection and inflammatory molecules. So we have to take care of what we are consuming as a macronutrient, because if we are consuming a food which is rich in any particular kind of macronutrient, particularly the carbohydrate, then it may lead to damage of our intestinal epithelial layer, and if it is impaired, if it is disrupted, everything will be directly released into the bloodstream. And then if it is released into the bloodstream, it may lead to different infectious diseases through the inflammatory responses. So everything has a direct influence on the gut microbiome composition, because if you are providing only sugar in your meal, in your every meal you are taking only sugar, then what microorganism will do? They require equal amount of protein, vitamins, minerals, everything they require, but they are getting only glucose. So their population will be decreased. Their population will be decreased. If you will be served only rice for 30 days and nothing else, what will you do? You will just leave that place. So likewise, bacteria also don't like food rich in only glucose. They require different kind of nutrient. The normal nutrient broth, which is the normal or the most common media for the growth of microorganism. So this, if in the nutrient broth medium we provide carbohydrate source, we provide protein source, we provide NaCl to make the osmotic balance. So all these things are rich in, we provide beef, peptone. So all these things are rich in carbohydrate, protein, a balance is there. So if a balance is there, microorganism will likely grow in it. But if we are providing only a single nutrient, so no bacteria likes only a single nutrient. So this is the reason we should avoid a sugary food in our every meal. We should have a balance of equal amount of carbs, protein, fats, and vitamins. So now next one. This is the detailed one. Dysbiosis causes, effect, and disease implication. What are the different kind of diseases we can expect if our gut microbiome is somehow altered? It means the disease which we can expect if our gut microbiota is altered. What we can have? Through this diagram, we can see we can have cancer. And the detail of this will be studied in the unit 3rd, module 3rd. Like how the gut dysbiosis is related to different kind of metabolic diseases, how it may lead to cancer. This is the part of our 3rd. So we will just have an introduction part in this unit, because this is an introductory unit, 2nd module. So we will have an in-depth cause and effect, so that how it can lead to cancer. So what type of cancer we can expect? We can expect lung cancer. We can expect colorectal cancer. Colorectal cancer is the most common one out of all the cancer, because in colorectal cancer our intestine will be influenced and our gut microbiome will directly influence the overall gut health. So it may lead to the, if our colon is not working properly, then what it will lead to? It will lead to some deleterious changes like the colorectal cancer, pancreatic cancer, because it is also, all these things are only because of our gut microbiome is maintaining different axis with different organ, like the gut colon axis, gut lung axis, gut pancreas axis. So therefore lung cancer, colorectal cancer, pancreatic cancer, because gut pancreas axis was also there, oral cancer. So all these cancers are very much likely to cause if you are having an impaired gut. So see how much knowledge we nowadays require to have a healthy lifestyle. Nobody knows about this thing. If they are eating, they are saying that we are not consuming any kind of drugs, or we are not smoking, we are not taking alcohol. But nowadays what you are eating influence the most, as per me, despite of the fact that you are not taking any kind of drugs, any alcohol, any such thing. But if you are not taking a clean diet, a healthy diet, then also you will be likely to have some fatal diseases. Now respiratory disease, as it is controlling our gut lung axis. So in the gut lung axis or gut pulmonary axis, then we may have some respiratory diseases like asthma, bronchitis, like our bronchi will be affected. And if bronchi will be affected, the alveoli, where the oxygen is enriched into our blood, or the hemoglobin, so that phenomenon will also be influenced, then that is known as the asthma and bronchitis. Now metabolic diseases, diabetes, India is known as the diabetic capital because we are having the increased incidence of diabetes nowadays at a very rapid rate. If we compare about the chronologically, then if you talk about the 1990s and 2025, then it is drastically increased, or it we can say that directly proportionality is there. With young age we are having the increased incidence of the diabetes, and not only just type 1 but type 2 also, and gestational diabetes is nowadays very common. Gestational diabetes is when a woman is pregnant, during the pregnancy she may get high sugar, because the diet also increases for the pregnant ladies, because they have to provide nourishment to their growing fetus. So their overall nutrition is increased, overall meal is increased, quantity is increased. So gestational diabetes is nowadays a third aspect of diabetes. uh, so many labs are not only just involved with the type 1 type 2, but nowadays labs including the AIMS as well, ICERs, they are all are related to the study of gestational diabetes in pregnant ladies, how they are prone to gestational diabetes, because their whenever they visit the doctor, their blood sugar is always monitored, because there are high chances of blood sugar increase in the pregnant ladies. Now brain disorder, how brain disorders we can see, because our gut is controlling the MGB, microbiota gut brain axis. So through this we can expect Parkinson's disease, Alzheimer's disease, depression, anxiety, stress, all those things you can expect if you are having an impaired gut microbiome composition. So there are so many diseases. We need to have a exact plan of what we are consuming, and we have to take only a clean diet, because all these things are very much threatening, that if we are somehow destroying our gut microbiota, we are prone to different kind of diseases. Now we can have a chronic kidney disease, because our gut is also maintaining the gut kidney axis. The first class which I explained to all of you that what are the different axes, what are the different things which is under the control of the gut microbiota. Now you can also expect different liver disease because the gut liver axis was also there. We can expect liver cirrhosis, we can expect hepatitis. So all these things are very common. Not only just alcohol will deteriorate your liver, not only just diet, alcohol will deteriorate your liver, but also the diet. Most of us, uh, if we are going through the liver test, so we will have a fatty liver. All those things, fatty liver, are only because of unhealthy food, junk food. So liver is the very important organ. If your liver is not good, the detoxification phenomenon will not take place properly. It will be affected. So if your liver is showing inflammation, then overall digestive system will be influenced. So other than that, you can have a colitis, inflammatory bowel disease, IBD. So you can expect different kind of diseases if your gut is not healthy. So ultimately, we have an insight about what are the exact composition of microbiota in our body. So if we know about the uh, exact composition, like which are the good bacteria in our gut, we can have some probiotics related to it. Like if we are having a wait if we are having bacteria A, a bacteria B, C, D. Now we are aware that our if our gut microbiome is intact, we are having A, B, C, D microorganism. Then if we are having some sort of impairment in our gut due to some reasons, so we can take probiotics which is enriched in this bacteria, this bacteria. So we can take those uh, probiotics. So uh, the learning of the overall gut microbiome composition is important. So this is again an important one. And heart diseases also, atherosclerosis, the choked arteries of your blood heart, and also you can have hypertension. So if you are having a good amount of microorganism in your gut, so they will lead to the production of metabolites. Increased metabolite production will be there, increased vitamin production will be there, short chain fatty acid production will be there. And if you are not maintaining a good balance, then it may lead to increase in the TNF alpha, lipopolysaccharide, inflammatory cytokine, and interleukin 6. So everything will be increased. So if these four factors will increase, it may lead to all these diseases. And if you are maintaining an a very intact epithelial layer, which is only possible if you are taking a good clean diet, if you are having an exercise in your daily lifestyle, daily routine, if you are not consuming any kind of drugs, any alcohol and such thing, so you are maintaining, you are providing a good environment for your microorganisms to grow in your gut. Which type of microorganism? The heroes of your overall metabolic machinery, or the good microorganisms will grow. And of what are those microorganisms? They are the obligate anaerobes. So for our gut, obligate anaerobes are the hero. So they will grow, and they will, if their metabolic machinery is intact, they will not allow to grow the facultative anaerobes. If facultative anaerobes will increase, like we have just now read the Salmonella typhi and Klebsiella pneumoniae. So if they will increase, they will overall increase the infection and inflammation in our body. So we have to focus on this upper one, not the lower one. We have to focus on the microbiota, not the dysbiosis. We have to eliminate this dysbiosis. And trust me, this is in our hand. We can control our overall gut health. Like try to have the healthy thing in the breakfast also, in the lunch also, and in the dinner also. Like your breakfast should be heavy and full of vitamins, carbs, protein, and your lunch should be always a good amount of all these nutrients, and your dinner should be light. It should not be like so heavy, and always there should be a gap of 2 to 3 hours, at least 2 to 3 hours. So all these things will lead for, we just read these as a tips, but these are not the tips. These are the, if you follow this religiously, no such disease can occur in our body. So we have to stick on that. We have to talk, we have of the refined flour and the all the processed food we have to eliminate from our diet. We don't have to take every time and all. For once in a week, it's fine, but not every day, every meal. So ultimately, we are only the responsible for deteriorating our gut health. Then we are complaining that we don't eat drugs, we don't take alcohol, we don't take tobacco. Then why us? So we are only the responsible for our own health. We are only the responsible for the buses. We are only responsible. If to be away from all such dangerous diseases, we have to take care of our lifestyle, take care of our diet, take care of good amount of sleep. Because if we are not sleeping properly, then also our body will always feel exhaustive, and then also our gut microbiome composition will be influenced. Because people are also conducting some research related to stress, the effect of or the influence of stress onto the microbiome composition. So ultimately, nowadays uh, we are just sacrificing our own rest for the sake of so many things. Like we are having so many dreams, we want to fulfill all of those, so we only have 24 hours, but we want to do a lot more, so we are just ignoring our normal sleep wake cycle. We should always have an at least 7 to 8 hours of sleep. If not 8, at least 6 to 7 hours are required. But we are not taking that. So ultimately, it will cause exhaustiveness. Your body will feel always tired, lethargic, exhausted. So if whenever we take a good sleep at a correct time, not sleep at 3 o'clock in the morning and till 9 o'clock in the morning. No, a good amount time for sleep is 11 to 5 or 6. I will not say 10 because 10 is not possible for any of us nowadays, because we are having a routine in which 10 is not possible for us to sleep. At least for me, it is not possible. So all these things are related to deteriorating our gut health. So whenever I am teaching this topic to all of you, I also get to know so many things. Like we all know everything. That, we have to eat, we have to sleep early, we have to sleep time, and we have to do exercise. All these things, but if we are studying this in a whole module, so we are providing us with so much of information and with so much of logic that we should stick to it. We just don't have to study it for a purpose, but we have to incorporate this in our life. So I also have knowledge of so many things which I don't know previously, like how it may alter. So it may alter in various way. We will study this in a very specific way in module 3. Like we have studied up till now that how they are responsible for boosting our immunity. So likewise, we will study in module 3 that how the impaired gut microbiota will give rise to the different kinds of cancers. Because nowadays cancers are very, very common. There was a time when cancer incidence was very, very low, but nowadays you can say this is the most common disease, like the normal fever, headache, and everything. You can if we are having fever right now in the class, no one will be there who don't know about an incidence of cancer in their neighborhood or in their own house. So all these things, cancer is nothing but an uncontrolled growth of cells. And how these cells are growing? Cells will always grow we are having where is my we are having trillions of cell in our body, and they perform all the function in a coordinated way. So cell will increase its growth or cell division whenever they will get glucose, because our body can only sense glucose. So it means whenever you are providing any kind of nutrient in excess, every time you are providing glucose to your body, so there may be chances that the overgrowth of the cell may occur. So if you are providing any sort of healthy nutrient to your cell, then they will not show the rapid growth or the rapid cell division. So all it depends on the food habits or the lifestyle we are having. If you are providing some sort of drugs to your body, or let's say alcohol, so alcohol will do what? It will reduce, it will, everything is digested in our gut. Gut is responsible for the absorption of nutrient. The major function of gut microbiome is what? It is involved in the nutrient absorption and digestion. So whatever you are consuming as a meal, it will directly go into your gut. So whenever you are taking alcohol or any sort of drug, then it will bind to your gut epithelial layer, IEC, intestinal epithelial cell, and this is a bad diet. So microorganism growth will be reduced. So if microorganism growth will be reduced on a regular basis, if we talk about if you are consuming alcohol on a daily basis, let's say for a month, then the overall there will be a decline in the good amount of bacteria, and pathogenic bacteria will be increased. So everything nowadays is related to what we are consuming, but we are taking this very lightly, that what will happen? I'm not consuming alcohol, I'm not consuming drugs or anything. So all it depends on the eat healthy and remain healthy. So these are the diseases which we have just now studied: the CVD, cardiovascular problem, cancer, obesity, diabetes, and also the CNS, because our gut microbiome directly controls the central nervous system. So as I was talking about the different levels of dysbiosis, we are having type 1 level, type 2 level, and the type 3 level. So type 1 mein kya kya hai? In type 1 we are having this form of dysbiosis, which when you lose good bacteria from your gut. When you have too much growth of harmful bacteria in your stomach, this is type 2. Dysbiosis can also happen when you lose your overall gut microbiome diversity. Like if some amount of good bacteria is lost, then it is type 1. It is the initial stage. You can say initial one. And type 2 is moderate one. And this is the final stage. And then from moderate onwards, it is alarming. From this 2, it is alarming situation. So you can say if you are normal gut microflora is disturbed, like slight decrease in the good population of good bacteria, then it is type 1. If too much of harmful bacteria is present in your body instead of good bacteria, like reverse is there, good amount of bacteria is low and bad amount of bacteria is high, then you can have a type 2 dysbiosis. And if you are having a very low nil amount of good microbiome composition or good bacteria in your gut, then you are having a type 3 dysbiosis. It means you lose both the good and the bad bacteria in your stomach. Then nothing is there in your stomach. How your food will be digested? So whenever we have started from our early classes the study of digestion, so we are not having an insight about the role of microorganism in easing our digestion, in easing our metabolic machinery. But nowadays the different curriculum also have the role of bacteria, or the good bacteria and the bad bacteria related to the gut. So there are also chapters related to the role of microorganism in easing our metabolic machinery. So we can have type 1, type 2, and type 3 dysbiosis, and accordingly our body will behave. If we are having type 1, then we can have some probiotics, and in type 2 we can have some drugs which can reduce the growth of harmful bacteria. And in type 3, we cannot have just probiotics. We need fecal transplantation, which is the topic of, I think, fifth unit, therapeutic approaches to dysbiosis. So we will study about what are the options if we are having an individual who has lost its overall gut microbiome diversity, then what we can do. So there is an option known as fecal transplantation, and also there are some other therapeutic approaches, which is the part of fifth module. So because if there is a disease, there is also a cure, because continuously scientists and researchers are working on it. So when there is an any kind of disease, so also we have an option of its treatment. But always believe on the fact that prevention is better than cure, because no cure is available nowadays that it will guarantee you a 100% surety that you will cure that particular disease. So prevention is always better than cure. Now this is again the symptoms, that if you are having impaired gut microbiome composition, or if you are having dysbiosis, now what will be the long-term effect or the short-term effect on your health. So your body may have chronic fatigue, digestive problems, trouble urinating, no urine formation will be there, or painful urination will be there, acid reflux or heartburn will be there, vaginal or rectal infections or itching, food intolerance, you will not be able to digest even a simple food in your meal. Every time you will feel bloated, you will have a acidity, gas related things, inflammation. And if you are having an inflammation, there is a disease known as the arthritis, that is the joints pain. You can have you expect, I was talking about the pure blood and the impure blood. If your body will have an impaired gut, everything will be all the inflammatory mediators will be directly bathed into your blood. So what it will lead to, it will lead to acne. What your dermat will say, your dermat will say that you need to purify your blood in order to have a good and healthy skin, good healthy fair skin. So skin rashes, psoriasis, all these things are the effect of dysbiosis. If you are not eating any good amount of food, then you can expect that skin quality or the texture is not so good. So apart from that, you can expect ADHD or issues with concentration. So ADHD is attention deficit hyperactivity disorder. So you will not be able to focus, or you will not be able to concentrate on a particular thing if you are having an impaired gut. And ultimately you can expect different central nervous system disorder, anxiety, depression, and all those things. So these are the long term effect or the short term effects of, if your gut microbiome is influenced, you can expect this kind of effects, which are very, very common nowadays. Like me and you can pick 4 to 5 out of all those things. Like we always feel tired, fatigue, we always have a digestive problem, sometimes we feel acid reflux, sometimes we are having bloated stomach, bloated gut, we are having inflammation. Many of us have acne and skin rashes and skin related issues so many times. And nowadays anxiety, depression, stress is a very common one. Nobody is there without having any kind of stress and depression. Like I am in a stress right now because I have to go to Kolkata back. I was from past 1 week I was at my home. So again anxiety and depression wala thing. So nowadays these are some of the things which you can expect if you are destroying your own gut health, if you are disturbing your own gut microbiome composition. So in order to remain healthy, you need to protect your overall gut microbiome composition. So this was all about the module 2. I hope module 1 and module 2 are crystal clear to all of you. Now from Monday onwards, 9 p.m. we can start the module 3, which is the which is little more detail about what we have studied in unit 1 and unit 2. So unit 3 we can have some more depth of how uh, And dysbiosis can lead to cancer, how it may lead to different kind of infection like the specific molecules. So we will study from Monday onwards. So this is all for the day. Now let me stop the recording.